guys for staying tuned as we continue conversations in entrepreneurship, this time talking faith, femininity and fearless entrepreneurship, redefining women's healthcare in the Caribbean. To have that conversation, we're joined by Dr. Rachel Corridon, the founder of Harmony Health. Good morning and welcome to the night.
Good morning. Thank you, Ayanka. Thank you for having me.
Well, it is necessary as this month has put a lot of focus on entrepreneurship, but you've taken it a little bit of a step further, making sure that it is very female-centric and also Caribbean-centric. Tell me what really birthed the idea of Harmony Health.
Basically, it was something in my heart. I kept dreaming this word, harmony health, and I wanted to create a space where women felt heard, understood, where they felt safe in their health management, but also it was birthed out of a simple request from a friend who asked me to assist her to achieve her goal of having a home birth. And this was many years ago. And so when she asked for it, I said, okay, well, let me go forth with the business idea. And we actually went on to care for her for three complete home births and taking her through her pregnancy. And so that's where it was born. It was born out of a simple request and also a vision and a passion for women, creating a safe space, creating a space where they feel understood, heard, and empowered to create their own health journey decisions.
Now, specifically as an obstetrician and gynecologist, of course, there will be certain focuses that are automatic with you, but you particularly use a brand philosophy of your body, your baby, your way. Tell me a little bit more about that, because a lot is unknown when it comes to the female body. We see every day new studies discovering things they should have known years ago. So how do you go about doing that in the Caribbean specifically, where often information pertaining to us is difficult to come by?
So basically, I try to let women be empowered, and that's through education, letting them understand the things that are happening in their body, the changes that they will go through from adolescence all the way to menopause. So one of the things I say is I treat women through all stages of life, and when I talk to them at their level. And so I want women to know that this is your body. Traditionally, medicine has been male dominated. It has also been a kind of paternalistic way of going about things. But I try to let my patients know that they do have choice and they do have a voice when it comes to making their decisions. But they can only do that if we as the physicians give them the information. So that's where I try to start, is by informing them. There are certain things that women just don't know about their bodies. And when we start those conversations, that's when they say, okay, I think I need to have a checkup. I think I need to come in. And you don't necessarily have to come to me when we have those conversations. But I just want you to know that there are avenues that you should seek for certain issues. Don't just stay at home thinking, well, this is how it should be.
Or Google yourself into panic, because we also do that now. Hole. Yeah, we definitely do. Now, you've kind of cultivated a little cult following, if you will, as your gentle gynecologist. And that is going to lead us into the entrepreneurship thing a little bit more, I think, because you transitioned from the hospital into running your own medical practice. That in itself is miraculous, but I imagine quite challenging as well. So let's talk a little bit about that transition, because you keep it gentle for us, but I imagine it wasn't for you.
Well, to be honest, I still have a hybrid, so I'm still public and private. But what made me want to venture out is, you want to put your own personal stamp on the way that you are able to do things. You don't always want to be in an institutional mold, so to speak. And so, as you mentioned, you're a gentle gynecologist. I wanted to be able to be free to speak, to meet with my patients to form a community. You know, I said before that in times past, women used to sit down in drawing rooms and have tea and discuss issues of life.
Right.
And so that's, you say a cult following, but that's basically what I try to do. I try to, you know, involve women in that kind of drawing room tea party, where we talk about things and we bring things in the forefront, difficult conversations at times, but we just want to stir the pot a bit and bring things out in the open so that they are able to have some more information and make some more informed choices and decisions.
Right. Now, cult in that instance definitely did not have a negative connotation to me.
I like it.
Because I think we've also mastered the digital media sphere so that you're able to reach people virtually very well. How do you think that digital media is playing a role in healthcare specifically? I mean, there's a lot of misinformation out there. As I said, we Google ourselves into panics. How are you navigating that differently?
As you say, we Google ourselves into panic. What I am able to do, I've done it too. I'm the doctor and I've done it.
Oh boy.
But what we are able to do as physicians who venture into social media, etc., is to ethically and responsibly disseminate information. And it's not like, this is not a consultation that you're having. So sometimes I'm very specific when people send messages after I may have done a post asking specific questions. I always direct them to a physician, etc. You need to come in, you need to be checked, you need to be examined. We cannot do this over social media, so to speak. This is just giving you the background, the basic information to help you to understand certain things. Let's say it's menopause. Do I have PCOS? Based on what she said, maybe I need to look into this. So it's basically giving information, allowing people, shedding light on issues. Some women may not have even known in times past that there were avenues that they could seek for infertility, for instance. But because we are now bringing the conversations out there, patients are a little more aware.
Now, one of the pillars of your actual entrepreneurial endeavors is faith.
Yes.
How do you bring faith into the conversation, the practice, and how do we benefit from that as patrons, patients?
Yeah. Basically, it's about truth, it's about honesty, it's about trust. So it's basically who I am, everything that I do. It's the gentleness even. You know, there's a scripture that said, love is patient, love is kind, it does not envy, it does not boast. So that's just who I am. And so when I approach a patient, whether it's public or private, you're seeing the same person. And so even in a moment, in a room, you may be able to interact with the patient where they are. Maybe they're in a sorrowful situation, they may be down, and you just interact with them beyond the medicine. So my faith takes it beyond the medicine and to the person themselves.
Well, you're definitely telling us how your entrepreneurial endeavors differ from others. But let's get more specific because, as you rightfully mentioned, it is a male-dominated field. So let's think to other females who are looking to get into a similar field or one that's male-dominated. What advice would you have for them?
I would say that you're not in competition with anyone, especially a man. You are who you are, and everyone has a unique position, and there is room at the cross for everyone. So you are able to bring your unique perspective to the business space, to this area of commerce. Be disciplined, be open, be adaptable, because things change. Things are not always going to be 100% well. There are some times where I had bookings that were not filled. You know, you're watching your calendar and you're like, what is going on? So you have to come up with strategies and also be willing to learn. Medical school doesn't teach us business. That's not one of the courses, right? So you have to be willing now to seek out avenues to learn, whether it is you want to do an MBA or just do some business courses, certificate courses, but do something. Learn social media, learn how it works, learn what works and what doesn't.
Right.
You have to know what doesn't work.
Lots of us know that part only. But I think in terms of entrepreneurship, that is part of it. You know, there is going to be success, there's going to be the difficulty. But it is Entrepreneurship Month. So what message would you give to Caribbean women about living boldly and pursuing their purpose specifically?
Well, this year, the theme for Entrepreneurship Month is building together. So as women, I want us, as women and as business people in this sphere, in the health sphere, let's collaborate. Let's not keep things to ourselves. You're collaborating with each other as physicians, you're collaborating with other health sector businesses, the pharmacists, everyone. The big pharma, everyone, you want to collaborate, and you want to collaborate with the patient as well. So you want to bring the patient into the conversations a little bit. Let's have workshops. Let's have things that involve the patient and allow us to enhance and change the way that we do things. Let's bring the commerce, the service, the passion together, and let's build.
Collaboration sounds like your long-term vision for healthcare entrepreneurship, but any more you'd like to add?
I would like to say, first of all, of course, thank you for this opportunity. But as women, let's not be afraid to make that jump, because entrepreneurship gives us freedom financially and socially. If your family is one of the things that is a priority for you, it allows you to determine when you do business, who you do business with. You are able to strategize and tailor your life the way you want to do it, and you're also able to have control over your purse. So take that jump, and whatever you have in your hands, you have an opportunity to use it for entrepreneurship.
Well, this has been a really delightful conversation. Of course, in terms of connecting with you, we can across social media platforms, but remind us of all the ways to connect.
So Your Gentle Gynecologist across Facebook, Instagram, TikTok, and YouTube. You can also email Dr. Corridon at harmonyhealtht.com, or you can go to the website www.yourgentlegynecologist.com.
Thank you so much for making the time to chat us up this morning. Truly inspiring and a really beautiful conversation to add to the Entrepreneurship Month conversations that are ongoing. I wish you the best, Doctor.
Thank you so much.
And I hope that you at home are inspired, not just as a woman, but to generally make the best of your talents, your passion, and remember to collaborate. Guys, come back to us, so collaborate with us. After these messages, we'll be back.
While she husband went outside and roam.